Hello friends, welcome to the HSC Coach. In today's video, we are going to discuss NEBOSH IGC Element 5, which is Physical and Psychological Health. So let us begin the session. In the previous elements, we understood why safety is important. We learned how a safety management system works, how risk assessment is conducted, and how monitoring is carried out. Detailed videos have already been made on element 1, element 2, element 3 and element 4. If you have missed those elements, you can check the link in the descriptions and watch them so that your NEBOSH IGC journey becomes complete. Today, we will focus on a very important topic, health. Not only accidents and injury, but also physical health and psychological health. Health problems are often silent. Unlike accidents, they do not occur suddenly. They develop slowly over time. Sometimes workers themselves do not realize that their health is being damaged. In this element, we will understand the difference between safety and health, types of health hazards, physical health risks, chemical and biological exposure, ergonomic hazards, occupational health, mental health and work-related stress, causes of stress, control measures, workplace violence and bullying, health surveillance, a real life case study and exam practice questions. By the end of these sessions, you will clearly understand how the workplace affects both the body and the mind. First, let us understand the difference between safety and health. Safety is mainly related to immediate injuries. For example, a fall, a cut or an electric shock. These incidents cause instant harm. Health, on the other hand, is related to long-term damage. For example, hearing loss due to noise, lung disease due to dust, skin problems due to chemicals, or stress due to excessive workload. Safety accidents are usually visible and sudden, while health issues are slow and invisible. They develop gradually and can become serious if ignored. Now let us look at the types of health hazards. Health hazards can be divided into different categories such as physical hazards, chemical hazards, biological hazards, ergonomic hazards and psychosocial means psychological hazards. Let us first discuss physical health hazards. These are harmful energy sources present in the workplace such as noise, vibration, radiation, extreme temperatures and poor lighting. Now first we talk about the noise. Noise is unwanted sound that can damage hearing and reduce concentrations. Short-term effects include temporary hearing loss, reduced concentrations and increased stress. Long-term effects include noise-induced hearing loss and permanent hearing damage. Control measures include eliminating noisy processes, using quieter equipment, installing acoustic enclosures, job rotations and providing hearing protections such as earplugs and ear muffs. Engineering controls should always be preferred before PPE. Regular hearing tests should be conducted as part of health surveillance. Now let's talk about the vibrations. Vibrations occurs when workers use vibrating tools or machinery. There are two main types. First one is hand-arm vibration, which can cause numbness and reduce grip strength. And second is whole body vibrations, which is common among vehicle operators and can cause back pain and musculoskeletal disorders. Control measures include using low vibration tools, limiting exposure time, maintaining equipment properly, providing training and implementing job rotations. Now let's talk about the radiations. Radiations is energy that travels in waves or particles. There are also two types of radiations. First one is ionizing radiations such as X-rays and gamma rays can cause cancer and tissue damage. Second one is non-ionizing radiations such as ultraviolet and infrared radiations can cause skin burns and eye damage. Control measures include shielding, reducing exposure time, maintaining safe distance, displaying warning signs and using appropriate PPE. Now let's talk about extreme temperatures. Extreme temperatures also affect health. Heat stress occurs in hot environments and can cause dehydrations, heat exhaustions, and heat stroke. Control measures include proper ventilations, rest breaks, hydrations, and lightweight clothing. Cold stress occurs in cold environments and can cause hypothermia and frostbite. Control measures include warm protective clothing, heated rest areas, and reduce exposure time. Now let's talk about poor lighting. Poor lighting increases accident risks and causes eye strain, headache, fatigue, and reduced visibility. Adequate lighting, proper maintenance, avoiding glare, and using natural light where possible are important controls measures. Now let us discuss chemical health hazards. Chemicals can enter the body through inhalations, skin absorptions, ingestions, or injections. Examples include dust, fumes, vapors, gases, and liquids. Health effects include respiratory problems, skin irritations, cancers, and poisonings. Control measures include substituting hazardous chemicals with safer ones, proper ventilations, safe storage and labeling, training workers, and providing PPE such as gloves and respirators. Now let's talk about biological hazards. Biological hazards include bacteria, viruses, fungi, and blood-borne pathogens. Healthcare workers, laboratory staffs, and waste handlers are at higher risk. Control measures include maintaining hygiene, vaccinations, safe waste disposal, and proper PPE. Now let's talk about ergonomic hazards. Ergonomic hazards are related to work design. Poor ergonomics can cause musculoskeletal disorders. Examples include manual handling, repetitive tasks, awkward postures, and poorly designed workstations. Common injuries include back pain, shoulder strain, and wrist disorders. Control measures include redesigning tasks, using mechanical aids, adjusting workstations, job rotations, and proper lifting training. Now let's talk about occupational ill health. Occupational ill health refers to diseases caused by workplace exposure. Examples include occupational asthma, dermatitis, hearing loss, silicosis, and stress related disorders. These diseases develop over years. Prevention requires proper risk assessment, exposure control, monitoring, and health surveillance. Now let us discuss psychological health and work related stress. Psychological health is as important as physical health. Work related stress occurs when job demands exceed a worker's capacity. Causes include excessive workload, tight deadlines, lack of controls, poor communications, bullying, and job insecurity. Effects include anxiety, depressions, reduced productivity, absenteeism, and physical illness. Control measures include clear job roles, realistic workload, employee support programs, open communications, worker consultations, and proper rest breaks. Now let's talk about fatigue. Fatigue reduces alertness and increases accident risks. Causes include long working hours, shift work, lack of rest, and heavy physical work. Control measures include proper shift planning, maintaining rest breaks, monitoring overtime, and adequate staffing. Now let's talk about workplace violence and bullying. Workplace violence and bullying can harm both mental and physical health. Violence may include physical assaults or threats, while bullying involves repeated negative behavior. Control measures include clear policies, reporting system, training, management actions, and a zero tolerance culture. Now let's talk about health surveillance. Health surveillance is a systematic monitoring of workers' health when they are exposed to specific hazards. Examples include hearing tests for noise exposure, lung function tests for dust exposure, and skin checks for chemical exposure. The purpose is early detections and preventions of serious disease. Let us consider a real life case study. In a manufacturing company, heavy machinery created a high noise environment. Workers were not provided with hearing protections and no noise monitoring was conducted. After several years, workers began complaining of hearing loss. Investigations revealed that no proper risk assessment, engineering control, or health surveillance had been implemented. Corrective actions included installing noise barriers, providing hearing protections, and starting regular audiometric testing. This case shows the importance of proactive health protections. Now, some exams practice questions for you. Explain the health effects of noise exposure, differentiate between hand-arm vibrations and whole body of vibrations, describe control measures for heat stress, explain the causes and effects of workplace stress, describe the purpose of health surveillance. Always include explanations and practical examples in your answers to make them effective. Now we are in the conclusion part. Element 5 focuses on protecting workers from physical and psychological health risks. It covers physical, chemical, biological and ergonomic hazards, stress, violence and health surveillance. Health risks may not be immediate, but they can be serious and permanent. Effective risk controls and monitorings are essentials for long-term well-being. Safety is not only about preventing accidents, it is about protecting both the body and the mind. If you have not watched the previous elements, make sure to watch them to complete your NEBOSH IGC preparations. We have also created an ebook on NEBOSH IGC and the link is available in the descriptions. Through both the videos and ebooks, your preparations will become stronger and more effective. That is all for today. We will meet in the next video with a new topic. Take care and goodbye.